Perfect. So I just want to welcome everybody. Thank you for coming on tonight. We still have participants jumping on. So I'm Peter Murano. I'm the superintendent of schools. Kate Cunningham, our district social worker, has put together a second webinar series on how do we help our students in this kind of crazy time that we're all kind of living through. So I'm actually going to turn it over to her, and she will introduce our panelist, and then we'll get started.
Great, thank you. So I am here to introduce Dr. Nicole Christian Brathwaite. I had the privilege of working with Dr. Nicole at Riverside Community Care and was really excited about this opportunity to bring her wonderful depth of knowledge to the Bellingham community. So just a little bit about her. Dr. Nicole is a nationally recognized board certified adult, child, and adolescent psychiatrist. She is the CEO and founder of Wellmind Psychiatry and Consulting Company. She has expertise in perinatal and postpartum mental health, trauma-informed care, telepsychiatry, mental health in communities of color, school psychiatry, implicit bias, and racism and mental health. She has extensive clinical experience with adults, children, and adolescents, transitional and college age youth. So we are very excited to welcome Dr. Nicole here. Thank you.
Thank you so much for having me. And I apologize for the delay, but thank you for your patience. So I will share my screen. I don't have permission to share. Sorry.
You should now.
Okay. And can everyone see the full screen? Okay, great. So I will talk obviously about how we can support our kids, but before even getting to the things that we can do, I wanted to make sure that we all have a basic understanding of how kids' brains work when they're stressed and why sometimes it can be so difficult to get through to kids and frankly, to get through to adults when we're stressed or overwhelmed. So this image is a great descriptor. So essentially when our coping skills, when our stress, our trauma, feeling overwhelmed, when it outstrips our ability to cope, essentially our brain goes into survival mode. So if you think about the functioning of the child's brain, first, the frontal lobe, the thinking, higher functioning part of the brain doesn't actually fully develop until they're in their 20s. So that part of their brain is already still technically underdeveloped, which is why teenagers make horrible mistakes and kids don't think about things until after the fact. But the lower part of our brain, that's the part of the brain that develops first. And that's our survival mode. So essentially what happens when you're extremely stressed or overwhelmed and you feel threatened, whether it's physical threat or emotional threat, or just feeling afraid about what's next or what's coming, or feeling like you're out of control or dealing with the unknown, which I know a lot of us and our children are experiencing, your brain assumes that it needs to go into survival mode. So what happens when you go into survival mode is that the blood flow, the focus goes to the survival part of our brain. And that sends us into fight, flight, or freeze. And I always use this example because I feel like this really helps to capture it. So I'm not originally from Boston. I'm originally from Philadelphia. And Boston drivers are just an anomaly to me. I get on the highway and I find that like my body tenses and I go into fight, flight, or freeze. And I don't even mean to. It's like as soon as I get into my car, I go into fight, flight, or freeze. And if someone, while I'm driving down 93, and I'm absolutely terrified because nobody's using turn signals and everyone's driving all over the place, and I just want to get from point A to point B, and I'm like, my heart rate's increased, my stress hormones are up, my muscles are tense, and I am just focused on surviving. If someone were to say, Nicole, tell me the definition or give me the diagnostic criteria for depression. In a normal day, when I'm not stressed or overwhelmed, that's what I do, right? I can recite that, no problem. Or solve this simple math problem, no problem. But when I'm in the car, when I'm in fight, flight, or freeze, driving through Massachusetts, I can't think clearly. And so when our kids are overwhelmed, when they're stressed, or frankly, even when we're stressed or overwhelmed, we are not accessing the highest functioning parts of our brain. We're going into fight, flight, or freeze. We are just trying to survive. So when we're supporting our kids, reprimanding our kids when they're having a difficult time, understanding, and we'll talk about this a little bit later, you can't really talk them through it. You can't really help them to think about what they did until they've calmed down. As long as they're still in that fight, flight, or freeze, they can't think clearly. And so not only does being stressed or experiencing trauma, and just to be clear, when I say trauma, I don't just mean extreme trauma like physical, emotional, or sexual abuse. I know that that's what we think about when we think of trauma, but a traumatic event is based on the individual. So I can't define what's traumatic for someone else. I can't define what's traumatic for my child. I have a 7-year-old and a 5-year-old, and my husband and I are also caretakers for our parents who are very ill. And my father-in-law fell, and my 7-year-old witnessed it and had nightmares for days after. I didn't consider that to be traumatic, but for him it was. And so when we're thinking about trauma, we also have to realize that anything that is really, really scary, or you feel out of control, or it threatens your safety or the safety of someone else, even if it's a perceived threat, for a child, that could be traumatic. And when a kid is overwhelmed, when they've experienced trauma, not only is there a shift in terms of how the brain is actually functioning, but kids tend to regress. And I'm sure if you think about over the last couple of years, you've certainly seen a lot of these behaviors in your children and family members. And frankly, if we're honest, even as adults, when we're stressed, we tend to regress too. We are more irritable, we whine more, we're snapping. And so and again, when we think about stress, we have to think about it through the lens of a child, right? Like a new sibling, that's stressful. And I'm sure many of us, if you've had more than 1 or 2 kids, you've seen that regression when a new sibling comes in. So even positive change can still be stressful if a child doesn't know how to cope with it. If children feel insecure or angry, or they just don't have the communication skills to express their feelings or actually seek support, that is another reason or way that may lead to regression. And ultimately, regression is a form of communication. And I'll say it's really tempting to scold a child when they're not acting their age, but there's a lot of evidence that actually says that's not incredibly helpful. And I know that that's kind of the automatic reaction. But if you recognize regression as a sign of communication and stress, and increase the support to a child versus increasing the discipline. And it's not that you're caving in. It's not that you're giving in. It's actually that you're supporting them because you recognize that they don't have the coping skills to manage whatever they're dealing with right now. And even in the classroom, I consult to and work with schools throughout the country. And teachers can tell you that behavioral problems have been on the rise the last couple of years. It has been very challenging, whether it's because kids are in and out of school because of COVID exposures, or a lot of kids are playing catch up because they weren't virtual learners. And so trying to transition back into school has been difficult. Or there are some kids who loved virtual learning. They didn't have to deal with the stress of going into school, and now physically being back in the building has been stressful. So again, I just wanted to point out some of the behaviors that will indicate to us when our children are completely overwhelmed or stressed. And so in addition to thinking about the regressed behaviors, this is what it may look like when a child goes into that fight, flight, or freeze, when they're no longer able to access the higher functioning parts of their brain. There's a child psychiatrist who's created something called the hand model of the brain. And essentially what he says is, if you were to assume that this was like, if you hold your hand up, fold your thumb in and fold your fingers over, this is an example of your brain. Your arm is your spinal cord, your wrist is your brain stem, and your 4 fingers are the higher functioning part of your brain. And the thumb and the inside of your palm are the lower functioning parts of your brain. So when you're in a good place, when we're healthy, we're stress-free, we're doing well, our brain looks like our four fingers curved over and supporting that lower functioning parts of our brain. When we're overwhelmed or stressed, when we go into fight, flight, or freeze, he describes it as our lid being flipped. Literally, the four fingers, the thinking part of our brain, disconnects. Because if you're in fight, flight, or freeze, if you're in survival mode, you don't need to think critically. You need to think in the moment. And so what happens is that literally this part is disconnected. And I'm sure we've been in those situations where a child becomes so angry, it's like they're in another place. They seem completely disconnected, like you can't get through to them until they're out of that period. That's because their lid is flipped, meaning like that thinking part of their brain is disconnected. And so whether or not it's a kid running, and flight can be physical flight, but flight can also be mental flight, where they're physically there, but they've completely checked out. Fighting in terms of being aggressive, or verbal behaviors, or screaming or yelling, or suddenly being really argumentative or irritable. And I know it's hard with teenagers because that's often their baseline, but it goes even beyond what we consider to be normal. Or freezing, where they're just, and I hear this from teachers all the time, the kids are just numb. They're not present. When you ask a question, they're just completely unresponsive. Or it's, again, it's like they're there, but they're not there. And it's important to recognize that effective brains are built, they're not born. So it is not natural for a kid to just have those coping skills to manage stress. We have to train them and teach that. And like any other muscle in our body, our brain is a use-dependent organ, meaning that the more you use it, the more you utilize the parts of the brain that we want to develop, the greater the likelihood that they'll be strengthened and can be used in times when you actually need them, like when you're feeling overwhelmed or stressed. And the way our brain works is actually amazing. So the parts of our brain that aren't used frequently, they actually get pruned. So if a child is constantly under stress and they're frequently in fight, flight, or freeze, that part of the brain gets bigger and the connections get more intense. The higher functioning parts of the brain, actually, they lose connections. And so when a child has experienced significant long-term trauma, there have actually been studies showing that the size of the brain is smaller, or the connections in the front of the brain are less. And so it's important that we are, in an ongoing way, and we'll talk about this as well, supporting our kids in developing and thinking through positive coping skills. And in addition to just stress in general, we also really have to acknowledge that a lot of our kids have lost significant parts of their childhood. A lot of the teenagers that I work with who are, freshmen or sophomore in college, they lost their prom. They didn't even really have a junior or senior year, or those who were freshmen in college, they never really got to stay on campus. So they didn't get the freshman experience. And we have to make sure that we're giving our kids the freedom to grieve, to be frustrated about the things that didn't happen the way they expected. I'm sure all of us envision what our junior or senior year of high school, or our freshman or sophomore year of college may look like. And it's disappointing when so much of that is taken from you and you have no control and you have no ability to regain that. And that, they can't make up the prom. And it's important to realize that grief, no matter what the grief is, and again, the same way we can't define what trauma is for a child, we can't tell them what to grieve and what not to grieve. And loss for them that's how they define it. What's painful for them is how they define it. And that grief is not linear. I think when we often hear about the stages of grief or loss, we just assume that you go through one by one and finally you get to that acceptance or even meaning stage and now you've recovered. But that's not the case. In fact, grief is actually cyclical. So there's some days you're in denial, there's some days you're angry, there's other days you're fully accepting of what's happened or what you've lost, but then there may be something that reminds you of that and you're back to that anger stage. And so I would say encouraging our children to express their grief, encouraging them to feel and sit with those negative emotions and acknowledge that it does suck. It is unfair that you've lost this, or you didn't have the time to spend with your friends before you had to go to college, or you didn't get to do that really exciting trip that you wanted to do because of all of the things that are happening in the world. That is frustrating. And they have every right to grieve and to feel that way. And as parents, as adults, our role is just to support them through it and not to minimize their grief, not to dismiss it, not to tell them to get over it, but to give them the opportunity to sit with it. Because there are many adults, and I'm sure many of us have never really learned to manage difficult emotions. We've never learned to sit with our own pain. And that's an incredible skill that if we can teach our kids now to manage that, then they won't have to look for unhealthy coping skills to manage difficult emotions. There have been some studies showing that there's been between a 200 to 300% increase of alcohol consumption over the last couple of years. And so what that tells me is that there are many, many adults who don't know how to cope. And we certainly want to change that for our children. So how do we help them? If our kids are really dysregulated, if they're in that fight, flight, or freeze, if they're behaving in a regressed manner, or clearly they're stressed or overwhelmed, what do we do? How do we actually support them through this? Recognizing that, unfortunately, because so many things are still very unpredictable, because who knows what's happening with COVID and what will change tomorrow, the likelihood is there will be times that we will feel overwhelmed or our kids will feel overwhelmed. And so how do we support them? There's a child psychiatrist by the name of Dr. Bruce Perry, and he's incredible. And I'm a nerd, so I think another child psychiatrist is like the coolest person ever, and I recognize that that's my own kind of my own. It says a lot about my nerdiness, but he's a really, really cool child psychiatrist, and he's written a number of phenomenal books about trauma and about how do we support kids through a traumatic experience. And so he's written 3 books. The most recent one he actually wrote with Oprah, kind of talking through trauma and how to support kids. His very first book is called The Boy Who Was Raised as a Dog. And it goes through his experiences with more extreme trauma, obviously, but basically even the kids with extreme trauma, there's certain tenets, there's certain basic structural things that need to be in place to support them. And so what he found is that no matter why a child is dysregulated, why they're frustrated, there's certain things that have to happen before we can get through to them, before we can get them to re-engage, before when their lid is flipped, to bring it back down and to help them shift and access the thinking parts of their brain. And so he insists, and through his research, he's found that it has to be in this order: regulate, relate, and reason, the 3 R's. And the order is critical, right? Because if you try to reason with a child who's in survival mode, they're not going to hear you, or it's just going to cause them to escalate. So the first thing is regulating. And I would even say, before regulating, it's making sure that the child feels comfortable, that they trust you. I say, obviously as parents, we have a very different relationship with our kids, but I tell teachers all the time, you can't regulate a child that doesn't like you or that doesn't trust you, because they don't see you as a safe person. And so, if you're talking to teachers, or if you have a child who tends to flip their lid, or who tends to be set off easily, or is struggling in school, it's important that they first develop a relationship with that child. And even if it's not you, if it's a babysitter or a family member, that safety has to be present first. So then you regulate them, and we'll go over what that looks like. But essentially, because the thinking part of the brain is cut off, we have to use interventions that don't require thinking. And that's usually sensory. So using our 5 senses doesn't require thinking. My oldest son, Aiden, when he was younger, he had a really hard time regulating himself. And we realized that taste was really important to him. So when he would really struggle, I would cut a lemon and let him bite into it. And that was such an overwhelming sensation for him that it helped him to kind of get out of the moment that he was in, take a few deep breaths, and then we could address it. And we'll look at other techniques and tips around how to regulate a child. Then after they've regulated, then you relate. So if they're a kid that enjoys hugs, or if they're a kid that likes to be touched, or if they're just a kid that, however they receive love, however they're comfortable receiving love, that's what you show to them. That's what you give to them. Letting them and reminding them that they're safe, they're loved, no matter the behavior, you still accept them. And then after they've calmed down, you're using those coping skills, you've related to them and supported them, then you're reasoning. Then you can say, hey, that was a really difficult situation. I'm wondering how maybe we could have done that differently. I'm wondering if if you think back, was there another way that we could have addressed that? And also recognizing that the regulate, relate, reason may not always have to be in the same day. Like you could regulate, relate, and then realizing that some kids need time and then do the reasoning the next day. And a lot of it, you'll have to work with your own child, and it takes practice. Nothing sticks without practice. And if we think about learning, how do we learn things? Through repetition and through, repeating things with structure, right? And so learning doesn't happen unless we've read it and looked at it or heard it multiple times, but also in a structured environment, in a structured and safe environment. And this is the cool Dr. Bruce Perry. And I love this quote from him. The more healthy relationships a child has, the more likely he will be to recover from trauma and thrive. Relationships are the agents of change, and the most powerful therapy is human love. And whenever I read that, I always want to say, oh, but it's actually true. And when we look at studies, kids who have experienced significant loss, or who have experienced natural disasters, or kids who have experienced significant trauma. And trauma for some kids is bullying, right? Trauma for some kids is experiencing discrimination because of their race or sexuality. When you look at interventions, the one intervention that consistently makes a difference is having at least one adult in that child's life who supports them and loves them unconditionally, no matter what the behavior is. And it doesn't have to be a parent. It can be a cousin or an aunt or an uncle or a teacher, but there needs to be a person that they know that no matter what, they can go to them, or that person will support them regardless of what's happening in the moment. And when we look at the studies, the kids who can identify their person, that individual who they really trust and can go to, those kids consistently do better than the children who don't have that level of support and who can't identify their person. And I always tell teachers in school, if you look at your class list, you should be able to name for every child who their person is. And if there's a child who doesn't have a person, who you can't identify an adult who really supports them, that's a problem. And the focus needs to be identifying a person for that child, identifying a source of support. And we know that there are plenty of kids, particularly the quiet kids, the anxious kids, the depressed kids, the kids who are not causing problems, but internally may be struggling. Those are often the kids that fly under the radar, but really those are the children that need that person, that need that voice, because they may not be able to speak for themselves. And when we're thinking about how do we become that person, whether as parents or as supports for other children in our community, one of the first things that we have to do to improve relationship is decrease a child's sense of being different or separate or ostracized or targeted, and to really work on increasing connectedness. And so there's actually studies that show in order to help a child feel connected and build relationships and feel confident, we have to intentionally create opportunities for there to be more positive interactions than negative interactions. And this is both at home and at school. And this is the same advice that I give to teachers. And so the ratio, there's actually been there's science behind it, and there's evidence. There needs to be a ratio of 5 positive interactions to every 1 negative interaction for a child to indicate that they feel safe and supported. And what does that mean for a positive interaction? Honestly, when they've looked at studies and they've asked kids what's positive, a teacher waving at them or saying their name and like, hey, good morning, Catherine, I missed you, or giving them a thumbs up, or simply getting a hug, or how was your day? I'm so excited to hear, or acknowledging their character strengths. You know what? That took a lot of courage to solve that problem, and you did it anyway, and that was amazing. Being very specific in your feedback. You finished this math sheet, even though I know you were dreading it, and I know it took a lot longer than you wanted to, but you did it, and I am so proud of you for it. And even nonverbal, like I said, thumbs up or a wink or even a smile or have a great day at school. So positive interactions don't have to be grand gestures. They can just be daily things that we are intentionally doing to make sure that we're providing that positive reinforcement. And children can do it for each other. right? Like encouraging siblings to point out the positives. My sons have a really hard time with that. They fight constantly, but I try to say like, look, he did this great thing. You should acknowledge it. And they're like, no, thank you. But actually trying to help them be that positive interaction for each other. And essentially every interaction is an opportunity. Every time that we're engaging with our child, it's an opportunity to shift that ratio to make sure that it's more positive than negative. And a part of the positive interactions also means giving a child control, a sense of autonomy that they, and I'm sorry, my kids just came back from baseball, so they might be loud. So giving a child autonomy, letting them know that you can affect change, you can make a difference. Things don't just have to happen to you. You can change your environment, change the way you operate in your environment. You can control certain outcomes. And one thing about trauma or stress, it robs us of our sense of control. And if, even again, if we think about the last 2 years, there were so many times where we felt like, there's nothing I can do to change this situation. This just feels like the world is going crazy and I have no say. And how paralyzing that felt, how invalidating that felt to feel like you can't do anything. And I love this quote: stress is directly related to how out of control we feel. So how do we help kids? How do we help our children feel a sense of control? So being, just being that obvious and clear with kids and letting them know that they have a choice, and, obviously doing it in a controlled way. So for dinner, we have 2 options. You can do spaghetti or you can do pizza. And, I want, hamburgers. That's a great option, but that will have to be for another day. How about you tell me which one you want, pizza or spaghetti? All right, I'll take spaghetti. Great choice. I'm so glad that you provided that input. And as minor as that may feel, that's important because I've given them the opportunity to choose. So you got to do your homework, and we have choices. We can either eat dinner and then do homework, or we can do homework and then eat dinner. And again, it may seem simple, but it's giving them an opportunity to have an impact on their environment. And also even helping around the house and making a big deal of it. Like every now and again, on a good day, my 5-year-old might rinse off his plate. And I'm like, look at you, that was amazing. You're taking the initiative to wash the dishes. He did 1 dish, but I still am making a big deal about it because I want him to feel successful. And we'll talk about this more, but success begets success, right? The more you do well at something and people praise you, the more you feel confident that you could do well at other things. The more you feel like you have the ability and the control to do more and to be successful at other things. Again, when we're talking about the ratio of positive to negative interactions, giving specific compliments are very important. So it's not just, you're such a smart kid, you're a really smart kid because you're so good at this, or as evidenced by, or for example, or, oh man, you're so strong. You're so strong because the way you just hit that ball in baseball and it flew halfway across the field, that was amazing. Because oftentimes we get vague compliments, but they're meaningless. So if we're able to identify specific points, then kids know you're watching and you're listening and you're paying attention to what they're doing. Again, asking siblings for support. It may be, hopefully it's easier for you than it is for me in my house, but again, you're modeling that generosity. You're encouraging your kids to model that support for each other. And this is a great graphic of when the pandemic first started and people were feeling out of control. There's a website called The Counseling Teacher, and she made this really great graphic. And obviously it's small examples. So sometimes we have to let go of the things we can't control, because if we keep trying, it will literally drive us crazy. So helping our kids also identify what they can change. My oldest son was being bullied, and we sat and we talked about, we may not be able to change what this other child is doing, but these are the things we can do. These are the things we can change to help you feel safe. These are the things that you can say or do to impact what's happening. These are the things that you can say or do to the teacher. This is where you can move your seat. This is, and so helping him feel like, I don't need to just be bullied. I don't need to just be a victim. There's things that I can change. And so in this graphic, what are some things that we can control or help our kids recognize that they can control? specifically thinking about COVID, limiting social media, limiting how much news we're watching, using distractions, finding fun things, creating a schedule where we're actually intentionally building in family or fun activities, doing the right things for your family in terms of keeping them safe from COVID. Things that we can't control, how long COVID will last. It's a worldwide pandemic, right? So there's certain things we can't, but we can do what we need to do and encourage our kids to do those things that help them to feel safe or help them to feel supported. And again, thinking about building that relationship and building that connectedness, one of the most important things for kids is for them to feel heard. And I am sure you've heard at least once if your child can talk, I'm sure at least once they've told you, nobody understands me, no one listens to me, you don't care, my teacher doesn't understand me. And if we're honest, there's some truth to that, right? When my kids come and ask me something, I already know it's going to be no. I don't even care what it is. I'm already prepared to say no. So half the time it's like the Charlie Brown teacher. I'm like, yeah, okay, no. Like I'm not actually listening. And so that's frustrating for them. So I realized even, preaching to the choir, I need to change my behavior. And so one of the best ways to connect with a child and to build trust is for them to know that they're heard. And when we are listening, we're certainly not listening to support them. We're listening to problem solve. We're listening to provide answers. We're listening to, help deal with this so you can get back to the other tasks. We're not necessarily listening just to listen, to understand, to learn. But that's important because we don't, I'm sure, again, you've all had the experience of sometimes you just want to talk. You don't need someone to solve it for you. You don't need someone to give you their opinion. You just need to know that someone is there to listen. Kids need that same thing. And so reflective listening is a great skill that may seem so silly and simple, but it's actually difficult to do. And so reflective listening requires that, 1, you've listened. 2, you're summarizing what you've heard. So it sounds like you're telling me that, and then you summarize the situation. Even better if you can add an emotion onto that, because one of the other things that's a great way to cope is to even know what you're feeling, right? Most kids have a limit of 3 or 4 emotions: happy, sad, angry. But what if we can expand that vocabulary so that they know that that angry feeling may actually be frustration or guilt, or even beyond that, like maybe they're furious. Maybe it's not just angry, maybe they're furious, maybe they're hurt, maybe they felt betrayal. And so when we're using reflective listening, being able to help them build that emotional vocabulary can also be helpful. So it sounds like this happened, and as a result, you're frustrated, and they can correct you. And that is okay for a child to correct you, because what that means is that I didn't understand you the first time. Please tell me again so that I can get it right. And it's amazing when I utilize this technique with kids, particularly adolescents. The response is like, you're the first person that understands me. Finally, you get me. Really, I probably don't. I just summarized what you told me. But that lets you know that I heard you. And so I created, let's see if I don't know if I will actually be able to share this. I created a TikTok channel because I get a lot of requests for education. So I created a video specifically on reflective listening. I maybe made like 3 videos because I cannot keep up with TikTok. Like it's a full-time job to try to create these videos. So like my TikTok is limited to like 4 videos, and then I gave up. But this is one of them. So let me know if you're able to hear this, and hopefully it actually plays.
Good morning.
Can you hear?
Another way to support our children, honestly, is to just listen. I think as adults, we often assume we have the answers, we have the solutions, and we're often so ready to provide kids with a solution without actually listening. So one of the things that I recommend to parents, but honestly to anyone in a relationship, is using a technique called reflective listening. Essentially, that means you are listening to understand, listening to comprehend, listening to summarize, but you are not listening to respond. You're not listening to provide answers, to provide solutions. You're literally just digesting the information. And so what does this look like? This looks like if your child tells you a story, or they're angry about something. before asking questions or offering your opinion, simply summarize what you've heard. Okay, so it sounds like this happened and you're frustrated. Is that right? Did I get that right? And giving kids the autonomy, the opportunity to correct you if you're wrong. So what does this look like? Let's see. Buddy, you were telling me that you were having a hard time at school. Can you tell me more about that?
Every time I tell my friends something, they ignore me and talk to each other.
Oh, so you're telling me that when you're at school, you feel like your friends aren't listening? Is that right?
No.
Okay.
I don't feel like it, I know.
Oh, I'm sorry. Thank you for correcting me. So when you're at school, your friends aren't listening to you when you're talking. That would make me feel pretty frustrated. How do you feel when that happens?
I feel frustrated.
Buddy, thanks for telling me. I really appreciate it.
Wait.
So, same story, but more typical parental response. Well, buddy, if your friends aren't listening or you feel like people are ignoring you, why don't you just tell the teacher?
The teacher won't listen to me.
Well, how do you know if you don't even try?
I just know the teacher won't listen to me. No, I don't. Never mind, Mommy.
You see the difference?
And obviously, eventually, if you need to problem solve, you get there. But you first have to make sure that you understand what they're looking for and where things are. In that moment, he wasn't looking for me to problem solve. He was just looking to express his frustration. And I love this cartoon because, as you know, effective listening is a great tool to use in partnerships and relationships too. I'm sorry, dear, I wasn't listening. Could you repeat what you've said since we've been married? And if it's a tool that you start practicing, you'll realize that it comes in handy in just about every situation. Because 9 times out of 10, when there's conflict, the conflict is secondary to miscommunication or poor communication. Other things that we can do to support our children is helping them to build resilience. And I'm sure that that's a term that we've heard many times. But essentially, resilience is the ability to cope with life on life's terms. It's the ability to cope with stressors and changes in life in a healthy and productive way. Resilient children don't necessarily experience less stress. They're just able to recover from it in a healthy way. And they're better able to deal with the stressors that they face on a day-to-day basis. They're not necessarily avoiding them, but they're going through life recognizing that they have the skills to deal with it. They're also better prepared to face future challenges because they've learned that there's some very effective skills that can help them deal with stress. Even if it's a difficult situation, it doesn't mean it's harder than what they can handle. And again, when we talked about the stress response, and we said that the frontal part of our brain, the prefrontal cortex, it disconnects when we're stressed. And there's been evidence showing, and actually looking at live MRIs, when kids or even adults, when we engage in a regular practice of mindfulness, it actually shifts the focus of the brain. So the part that lights up is the prefrontal cortex and not the survival part of our brain. So it's reducing activity in the fight, flight, or freeze, that survival part. And this allows our thinking part of our brain to actually regain control, and it calms what's also described as the emotional brain. And again, I'm sure we've all been in a position we're so angry we can't think straight. We're so, I even think about like being 13 years old and being so absolutely in love, and you're completely blinded to every fault, and you look back like, what was I thinking? And that's because that emotional part of the brain had completely taken over, and the thinking part was just not at all connected. But mindfulness helps us to regain that control. And when our emotional brain is calm, we're calm. When our child's emotional brain is calm, they're calm and they're able to process and problem solve. And mindfulness is just simply focusing your awareness on the present moment, calmly noticing your emotions, noticing your sensations without judgment, without any criticism, and just being where you're at, doing whatever you happen to be doing, but being present in the moment. And you can be mindful in doing just about anything. Like mindful eating is actually considered a technique to help with weight loss, right? So often when we're eating, We don't even remember what the food tastes like because we're checking our phone, we're watching TV, we're conversing with others. We're not in the moment. And so half the time we end up overeating because we're not savoring the moment, we're not paying attention. So mindful eating means that you're smelling. And again, going back to the 5 senses, you're smelling, you're tasting, you're experiencing, you're feeling. Before you chew and swallow the food, you're letting it sit in your mouth. And there's actually a mindfulness technique that I often use with kids pre-COVID when I would go into schools and work with kids would be I would force them to eat a Hershey's Kiss, but it had to take 5 minutes. They could not finish the Hershey's Kiss before 5 minutes. And when I tell you it was killing these kids not to just gobble it down, but like we had to look at the wrapper. We had to feel the texture. Then we had to open it and we had to look at the different colors, the gradients of the chocolate, what's the difference between the wrapper and the chocolate. Then we had to smell it and then putting it in their mouths and not chewing it, but tasting it. If you move it in different parts of your mouth, does it taste different? And again, teaching a child to be present means that if they're overwhelmed, they're not disconnecting because they're able to remain in the moment. And there's actually a study showing that when mindfulness is incorporated into the school day, kids do better. Kids do better academically. The rates of disciplinary actions decrease. And when those same schools lost funding and weren't able to engage in mindfulness practice anymore, all of those things increased. All of those things worsened again. So disciplinary rates increased and academic performance decreased. And this is, he's now 5, but this is my 5-year-old when he was 3. And he also feels emotions very strongly. And I remember his preschool teacher telling me she was going to teach him mindfulness to help him regulate himself. And so one day, my older son was picking on him and teasing him. And he was like, "Oh, mommy, I'm so angry. I'm going to breathe." And he just sat on the floor and just assumed that position and started breathing and repeating a mantra to himself. He used to say, "I am calm," but in his words, it was "I'm calm." And I have very few pictures of him with pants on because he just pants don't agree with him. But so I just thought, I'm like, if he can do it, I should be able to make this a regular practice. And I realize we're running out of time. So I'll try to move a little bit more quickly because I do want to make sure we have time for questions. So these are just examples of some of sensory interventions we can use when we're trying to do that regulate part, the first R. And again, when you're trying to regulate a child, you want it to be something that they don't have to think about. So potential examples, taste, biting into a lemon, Sour Patch Kids. I used to, in my office pre-COVID, I had 2 things all the time: a huge pack of Sour Patch Kids and multiple tins of cinnamon Altoids, right? Because if you put either of those in your mouth and you hold them there, it is an intense physical sensation. So when I had a kid in my office and they were getting dysregulated and I could tell they were really getting frustrated, I would say, "Here, eat some candy, hold it in your mouth." And very few kids can resist candy. And so that would give us a moment to re-regulate. Some kids need the physical, the tactile sensation, so a weighted blanket or even just a hug. Some kids like things with temperature, different temperatures. So sometimes my 5-year-old, when he's angry, he'll hold an ice cube until it melts. And that is such an intense physical sensation. There are certain hand sanitizers that are scented. So keeps your hand clean and you can have a lavender smell. So we use lavender all the time in my house. And when they're having a hard time, I spray their hands, ask them to rub it together and take 10 deep breaths and just using that sensation. Some kids in some classrooms have entire boxes of coping skills or fidgets or things that kids can use without thinking to help them get out of that negative emotion or experience. If you go to my website, www.wellminds.consulting.com and go under resources, I have this handout there that essentially provides a list of other grounding techniques or coping skills or mindfulness techniques that can help you or your child re-regulate. But again, like any skill, if it's not practiced, it won't be effectively utilized. And so I always tell families, you have to practice when a child is not dysregulated in order for them to actually use it when they are. And you have to find what works for them. Some people are taste people, some people are touch or tactile, some people are smell. And you have to figure out for your child which is that best intervention. But again, it needs to be something that's practiced when they're in a calm state and it's practiced over and over again. And you all identify what works so that when they're having a hard time, you can offer it to them where they can seek it out themselves. And you can download this for free from my website. And another positive interaction or engagement is just, again, helping a child focus on the positive. So you're focusing on their strengths or their positives, but also teaching them to do the same. So helping a child see their day as a partial success rather than a complete failure, right? Celebrate the small victories. Modify what a good day actually looks like for you. And I know we create to-do lists, and maybe we had a to-do list of 15 items and we only got 10 done. Usually what we focus on is what we didn't complete. We're not acknowledging all of the things that we did. So helping our children express gratitude. And there have actually been studies that people who have a regular practice of expressing gratitude or going through their day identifying what they're grateful for have improved quality of life. They have less likelihood of experiencing a mood disorder or depression, and they tend to sleep better. And those are just a few things. There are also even things that have shown that it can help improve relationships. There's even a study looking at heart disease, and people who keep a daily gratitude journal had less likelihood of having increased complications after a cardiac or MI. So acknowledging the small victories helps us to become more appreciative and increase feelings, again, of confidence and success. So when my kids come home at the dinner table, I'm like, tell me something new and tell me something good that happened today. And you know, their instinct is, well, this happened and he didn't share with me. And I'm like, okay, you know what, that I agree, that's frustrating, but what was something good that happened today? What's something that you were grateful for? Even if it's as simple as, Mommy, you packed my favorite snack today and that was super exciting for me. Awesome. That's something that we can be grateful for. Or at the end of the day, I'll ask them to give me at least 2 things that they're thankful for. Because that's a great way to reflect on the day and go to sleep thinking about the positive rather than perseverating on the negative. And so with all of our children, it's important to recognize that to help them deal with the stress in life, to help them manage all of the difficulties that we're all facing right now, we have to take a strength-based approach. We have to focus on what they can do well and helping them focus on and building those parts of themselves. And there's a question of whether or not Albert Einstein actually said this quote, but I really appreciate it. Everybody is a genius, but if you judge a fish by its ability to climb a tree, it will live its whole life believing that it is stupid. And so making an effort to label what's right with our kids, label what they can do, again, helping them build that confidence, providing and giving them the tools to become more resilient and the ability to weather these unpredictable storms that are going to come, they're just frankly inevitable. When we're able to support our kids and help them build their strengths, they feel more confident to do that on their own when they're not with us. And successful people achieve excellence by developing their talents and their strengths. Every child is good at something. Every single child has a strength. Every child can do something incredible. We just have to help them find that. And then no matter how difficult the day, if we're still able to say, I know that was challenging, or I know math isn't your subject, but look at how great you were in English. Look at how well you did in baseball. Look at how great of a friend you are. And helping them to focus on that and not dwell in what they're struggling in. And then the last few minutes, I'm just going to also focus on us, right? The parents. There are no healthy children without healthy adults. If we are not able to take care of ourselves, we cannot take care of our children. So even though the focus of this talk is how do we support our kids through all of the unknown, the first thing is that we have to make sure that we're modeling the healthy coping skills, right? Like kids are looking at us. So if we tell our child to focus on strength-based approach, but we're constantly making self-deprecating statements, it's not going to stick. It's not going to make sense. Or if we're telling our kids to use positive coping skills, but they're seeing us be very avoidant or isolating or using unhealthy coping skills, it's not going to make sense. And also, if we're saying being healthy is setting limits and saying no and prioritizing peace and safety, but they're not seeing us do it and they see us say yes and then be really resentful after we do it, it's not going to stick. So a part of prioritizing ourselves is also recognizing what our limitations are and helping our kids recognize what their limitations are. So I love this. No is a complete sentence. It does not require justification or explanation. And I will also share these slides so that you'll have all of this, since we're kind of flying through this last part. But also thinking about where are you right now? Are you in a place that you're just are you in that fight, flight, or freeze every day? Do you wake up dreading going to work and immediately go into fight, flight, or freeze? Are you just surviving? Or are you in a place where you're actually thriving? And what is that? How do you know? How do you know if you're in the survival state, just trying to make it through? And that's what we're modeling for our kids? Or are we in that thriving state where we're actually doing well and utilizing resources? And these are just a few examples of the differences. Sorry, my 5-year-old was trying to sneak in. So when you're surviving, you tend to be reactive, right? Like you're not planning in advance, you're just dealing with things as they come. You tend to isolate. You tend to be the person that refuses to accept help or even acknowledge that you need help. You're fearful, or you're making decisions from a place of fear rather than a place of motivation or having a vision for the future. You're in that fight, flight, or freeze, and you're just stagnant. You're not moving. And this is just my list of what I look like when I'm in that surviving versus thriving. But what does that look like for you? And how can you identify that for yourself? But again, this is an exercise that you can go through with your kids too. Like, how do you know when you're not doing well? And that's one of the coping skills that's helpful, is just knowing when things aren't going well before they crash, right? Like seeing that we're teetering on the edge, and let's catch it before it gets bad. And this is just another example of things that as adults we need to be aware of. What does stress look like, right? So like this is even the precursor to the thriving versus surviving. When you start getting to that point, are you more, less patient, or have a low frustration tolerance? Do you find that you're achy all over, or you're having headaches? Are you not focusing as much? Are you sleeping too much or sleeping too little? Are you pacing, or you're nail biting? And I would literally say, sit down and circle the items on this list that let you know when you're not doing well, and do the same thing with your child, particularly if they're old enough to understand. Help me know when you're struggling. What are some of the things that change? And sometimes we don't know, right? Like you don't even know that you're having a hard time until someone says you're pretty irritable today. And then all of a sudden it clicks. And so helping our kids be able to be more proactive than reactive. I won't go into detail on this, but this is basically to say that sleep is so core. So when I'm treating people for depression, anxiety, one of the first things I ask is, are you sleeping? Right? Because I can give you every treatment in the world, but if you're not sleeping, it doesn't matter. And so it seems so simple, but these are the basic things that we have to do to both care for ourselves and build resilience in ourselves, but also building resilience in our children. And again, these are my references, and I will certainly share these slides so that everyone has a copy.
Thank you so much. That was so informative. We have a few more minutes, so if there's anyone that would like to write some questions in the chat, hopefully we can get to some of those. I do have some questions that come up, so maybe in the meanwhile, while we allow people to chat, one of the things that I am also a Dr. Bruce Perry fan, so I just wanted to say that out loud. And it looks like you'll be sharing a number of great resources. There's kind of a belief that some kids are resilient and some kids aren't. And you're either born with it or you're not. And I was kind of hoping you could speak to that because you kind of touched upon it briefly.
Yeah, I mean, there's looking at the temperaments. So there's a lot of studies showing that certain temperaments tend to be more resilient, and that may be true. But you can have 3 kids in the same situation, and one kid comes out okay, and the other 2 are really struggling. And there are certain inherent traits that may either allow a child to receive more support, or that allows them to be able to fight through it. But we don't really want to risk that, right? Like that could be random. But we do know that there are things that we can proactively do to really ensure that we're building that resilience without waiting for the nature part of it. We can provide that nurture and giving them the foundation and the building blocks. Because again, as I mentioned, effective brains are built. So we can't just rely on, well, I was a resilient kid, my grandfather was a resilient kid, they'll figure it out. They may not. And it's better to give them the tools than to hope for the best.
Great, thank you. So I'm going to keep going until more people put their own questions in the chat. But so I also have a 5 and a 7-year-old boy. And so I can definitely relate to a lot of that. And I think some of the things, that a lot of parents have seen in COVID times is, with the simultaneous regression and then the uptick of conflict in the house and dealing with that. Are there any tips or suggestions that you would make to parents that are trying to manage their own stuff and also trying to manage the dueling, in a way, regressions of their children that may or may not understand why the other one could do something and now they can't, which.
Yeah, no, that's a great question. And I, there's both the individual work with kids and then the group work. So in all of the skills that we've talked about, taking the time individually, because also some of the regression is just the kids feel like they're not getting enough attention. And, it's sometimes we feel like we're giving them too much attention, particularly when they were home all of the time. Like we could not give them any more attention, but it's not always the attention that they want. And so that actually having that engagement, using those communication skills, using the reflective listening, that's engaged attention. And that tends to have a very different response from a child than just being present, but not being interactive. And so dedicating specific time to each individual child if possible. And I know we're all very busy, but even if it's, and again, providing that structure. So 5 minutes, 10 minutes, 15 minutes on Monday and Wednesday, this is our time. And this is time dedicated to just us. And that's time that can be fun time, but it can also be time that you can use to build skills. So there's it's similar to Uno, there's a card game called Mad Dragon. And it helps kids manage anger, particularly for those really irritable, frustrated, angry kids. And so when I have my individual time with my kids, I use tools like that, where it feels like fun, but we're also practicing and learning some coping skills that hopefully the next time they have a run-in with their sibling, they can actually utilize. But then also, so having that individual time, supporting them, working with them, modeling healthy coping skills, but then asking them to model it for each other. And even though it can be frustrating, giving a child the opportunity to teach someone else, that helps build confidence as well. And, particularly if it's the younger child teaching the older child something, that's one, meaningful to the younger child, but it also shows the older child that your sibling may have some use. Like you don't have to completely discard them. And again, helping them build that relationship outside of just play or outside of just conflict or argument, but building the communication skills and helping them learn how to converse and be able to live with each other. It's, there's no perfect answer, but a lot of it, again, is based on communication, but it has to be taught.
Wonderful. Well, thank you so much. We really appreciate you coming and giving us your time this evening. As she said, we are happy at the conclusion of this, we will be mailing out, you said the slides, and then we'll send out this video for any Bellingham School District staff. The PD link will be in that as well. So you'll see that in the next couple of days. And if there's any questions, feel free to reach out to me. My phone number is on the flyer and you can always email me. All right. Thank you all very much.
Thank you.